Namaste. I am Dr. Hitendra K Garg, working as a senior consultant in gastroenterology hepatology at Apollo Hospitals. Today we'll discuss about the cirrhosis. Cirrhosis is a chronic irreversible condition of a liver where the healthy liver tissue of a liver is replaced by the chronic fibrotic and the scar tissue. We'll discuss how to live with this cirrhosis apart from drugs. So we have to do certain lifestyle changes. We have like the healthy diet. We do exercise. We have to control our weight. We have to control diabetes. We have to control our hypertension. What are the lifestyle changes required in patients of cirrhosis? In patients of cirrhosis, lifestyle changes is very important. Apart from the drugs, the lifestyle changes, the first and foremost is the balanced diet. There are certain do's and don'ts which one should avoid the taking excess of alcohol or even alcohol. One should avoid the salt. One should avoid the excess of fat. One should avoid the excess of carbohydrate. One should avoid the raw fishes, raw oysters, shellfish, and what should be take excess good amount of protein, minerals and vitamins. So one should keep himself or herself hydrated. How soon one can recover? In patients of cirrhosis, the certain the complete recovery is not possible. It is because it's a irreversible chronic condition. However, it requires some patients, those who are presented to us with the acute on chronic liver failure. In those patients, they will improve, they will take at least 2 to 3 months to recover. Any trends in patients of Indian population related to dietary trends? So if we look at the dietary trends in India vis-a-vis the Western world, we have more of a vegetarian food, they have more of a non-vegetarian food. But if we look at the disease per se, the change in the dietary trend is not responsible for the change in the etiology of a liver disease, etiology of a cirrhosis in patients of in Indian populations. Can it be resulted from the medicine taken from other diseases? Yes, of course, the cirrhosis can happen. The fibrosis, advanced fibrosis or cirrhosis can happen in patients of taking methotrexate for rheumatoid arthritis for a long run. Once the cumulative dose is higher, then it increases the fibrosis of the liver and can cause the cirrhosis. The certain other drugs like the amiodarone, which is used for the control of the heart rate in patient of cardiac diseases, it also increases the fibrosis in patients of liver and can result into the cirrhosis. Can I have cola, curd, juices and pickles? In patients of cirrhosis, cola, juices and pickles one should avoid. As far as the curd is concerned, it contains a lot of probiotics, so one can take the curd. Curd is good for liver patients or in patients of cirrhosis. However, one should avoid all carbonated drinks, juices or the pickles. Pickles contain the high amount of sodium which may lead to the development of ascites or the pleural effusion. Which fruit, vegetable and meat can I have? So in patients of cirrhosis, fruits, all kinds of fruit is helpful because they contains the antioxidants, provided the patient should not be a diabetic. In patients of diabetic, the guava, the papaya is more helpful. They contain some more fiber also. If we look at the meat, non-veg, one can take the protein like the chicken, one can take the fish, but one should avoid the red meat, that is the mutton. For vegetable, in patients of cirrhosis, all kind of vegetable, especially the green leafy vegetable which contains the lot of carotenoids, which contains the lot of antioxidants, they are more helpful. Will I gain or lose weight in patients of cirrhosis? In patients of cirrhosis, early cirrhosis, like we call it as a compensated cirrhosis. Initially, we might lose weight. Once we become a decompensated cirrhosis, where the fluids gets accumulated in our peritoneal cavity, that is we call this as ascites, and if the fluid gets accumulated in our pleural cavity, we call it as a pleural effusion. So once these excess of fluid develops in our body, this might increases the weight. So initially we might lose weight, but later on in when the liver disease advances, we might gain the weight. How much exercise one can do in patients of cirrhosis? One should do according to their capacity. One should not be dehydrated because of the doing excess of exercise, and at least one should do 3 to 5 kilometers brisk walk in a day. Warning signs to look for, especially for the family member. In patients of, if suppose in the family one member is a cirrhotic. So what should the other families they were thinking of? Like if a patient, the other family member start losing their weight, they become malnutrited, their muscle is losing, they were developing a pedal edema, they were developing a red patches on the thighs or abdomen or on their arms, they develop some altered sensorium, if they develop a jaundice, these all are the warning signs in patients of CLD for their family members. So today we discuss about the cirrhosis. What are the lifestyle changes required? Most important, as I told, it's the exercise and the balanced diet. Balanced diet, one should avoid the alcohol, one should avoid the carbonated drinks, one should avoid the fatty foods, one should avoid the raw fishes, shellfishes, and one should take the excess of or enough amount of protein, one should take vitamins, one should take the minerals. So in case in nearby or your near relatives develops these warning signs or the symptoms of cirrhosis, please consult your nearby hepatologist or liver doctor. Namaste.